we learn of the negative effects of this pandemic, the more we realize there has never been a greater need for this legislation. The reality is that 43% of adults in this country suffer from a mental illness, and the number is higher for our children. About 51% of children between the ages of 6 and 17 have been treated or diagnosed with a mental health disorder. And in New Jersey this year alone, about 12% of New Jersey youth have at least one major depressive episode. Even scarier, 56% of those cases did not receive any mental health treatment for their episodes. We know that if untreated, mental illness can have ripple effects on our health, our economy, and can be both heartbreaking and devastating for the loved ones suffering from this affliction. The estimated cost of untreated mental illness nationwide is over $100 billion. And probably most concerning, suicide is the second leading cause of death among people ages between 10 and 34, and is shared with our behavioral health experts around the state. 1 out of every 5 teenagers have contemplated suicide during this pandemic. Ladies and gentlemen, I tell you this because while we are still learning about the ways in which the virus can affect our body, its impact on mental health is pushing us into another crisis, the mental health crisis, and it's hitting our children the hardest. Some may ask, why are we doing this now as children are starting to learn from home? I would answer that for 2 reasons. One is that sense of isolation is even bringing further the sense of anxiety, depression, and the need for this. And as this virus continues to now hit the much talked about second wave, and in many cases maybe even a third wave, what we know for sure is that the vaccine is going to be implemented as we speak today in New Jersey. And these bills must be enacted in order that we can hit the ground running as our children return to school, and a whole new set of anxiety that will encounter that and helping our children succeed in this new order as we come out of the pandemic. These measures will give our schools the tools and resources they need to be able to deal with the mounting issues stemming from COVID-19 when students return to school.